you know the signs of colon cancer? Sometimes the symptoms may be subtle, chalked up to stomach troubles, or downright embarrassing to talk about. Well, it's time to speak up. Moffitt Cancer Center gastroenterologist Dr. Cynthia Harris is here to answer your colon cancer questions live right now on Facebook as part of Moffitt's new Ask the Expert Facebook Live series. Colon cancer is the third most common form of cancer in the United States and the second leading cause of cancer death. But there is good news. Colon cancer is one of the most preventable forms of cancer, and more people than ever are beating the disease. How are they doing it? Let's find out right now. Welcome to Moffitt Cancer Center's live Ask the Expert series. Today we're talking about colon cancer. Now, even though it's one of the most preventable forms of cancer thanks to colonoscopy screenings, it remains the third most common form of cancer. In fact, more than 100,000 Americans will be diagnosed with colon cancer this year alone. March is Colon Cancer Awareness Month, and I'm joined by gastroenterologist Dr. Cynthia Harris, and she's going to tell us a little bit more about how we can treat and even prevent the giant inflatable colon and see firsthand the difference between a healthy colon, colon polyps, Crohn's disease, and below. Dr. Harris can tell us the basics of colon cancer, debunk myths, and even separate fact from fiction. But the one thing she can't do via Facebook Live is offer personal medical advice or make a diagnosis. For that, please call 188-MOFFIT or visit moffitt.org to make an appointment. We also hope you note that the Ask the Expert Health series is a general health and wellness discussion and is not meant to provide a medical diagnosis, treatment, or to replace medical care. Please refer to your primary care provider for those personal health treatment options. Thank you so much for joining us today, Dr. Harris. Now, as we heard earlier, 100,000 Americans will be diagnosed with colon cancer this year alone, making it the third most common form of cancer and the second leading cause of cancer deaths. But the good news is it is preventable. What are some of the things we can do to prevent colon cancer?
Oh, thanks, Nancy, for having me this afternoon. I'm so excited to be here and talk about this very important topic. Colon cancer, as you mentioned, is one of the third most common cancers in our country. So it's very important that we try to find a way to prevent this cancer. One of the most important things people can do to prevent this cancer is undergo some form of screening test. And today we're here to talk about the most important and the best screening test that we physicians would consider the gold standard for screening, and that's colonoscopy.
And who should get a colonoscopy?
So in general, there are many guidelines with recommendations regarding colonoscopy, but the American Gastrointestinal Association and some other GI societies would recommend that all patients, regardless of gender, undergo their first screening colonoscopy at age 50. That includes most or all ethnic groups with the exception of African Americans who we think should undergo colonoscopy at an earlier age, specifically age 45. So colon cancer affects males and females almost equally, with a predisposition for males of about 25% more. So regardless of if you have a family history of colon cancer or colon polyps, it affects everyone. So it's of utmost importance for people to undergo screening tests.
Perfect, and this is great information. Again, we want to remind you that Dr. Cynthia Harris is here to answer all of your colon cancer questions live via Facebook, so be sure to submit them in the comments section below. Now, right now, we're going to our first Facebook question, and it comes from Harold. He is wondering if a patient with stage 4 carcinoid tumors should be screened for colon cancer.
Well, thank you, Harold, for your question. That's a very good question and somewhat specific, so I'll do my best to answer it. In general, what we know about carcinoid tumors, also known as neuroendocrine tumors, are that they are very indolent, slow-growing tumors. So even in a patient who has stage 4 disease, they can expect to live a healthy, longer, active life than possibly someone else with a cancer of that stage. So in general, I would say that all types of screening would still be appropriate for that patient, but I would defer to the primary physician taking care of that patient who knows that patient better so as to help them make the best choice for them.
That's a great point. We do want to remind everyone that Dr. Harris is here to answer your Facebook questions live, but she cannot make a diagnosis. We do encourage you to call 188-MOFFIT or log on to moffitt.org to make an appointment. Now, approximately 90% of colon cancer cases occur in people age 50 and over. But a new study published yesterday by the American Cancer Society showed that colon cancer cases amongst older adults have actually been decreasing But colon cancer has actually been increasing amongst adults in their 20s and 30s. The researchers aren't exactly sure why. Our next question comes from our Facebook fan, Brittany. She says her 5-year-old son has had 3 colonoscopies that has showed polyps in his colon, and she's wondering if she and her husband, who are both in their 30s, should get colonoscopies even though there's no other family history of colon cancer other than her son.
Well, thank you, Brittany, for your question, and I'd like to say that obviously our hearts go out to you. Anyone who has a sick child is under quite a bit of stress and worry, so we appreciate you taking the time to ask that question. This is actually a very rare instance. We usually don't see colon polyps in children. If we do find colon polyps in children, it lends us to believe that there's possibly an inherited form of colon cancer in that family, or potentially a polyposis syndrome that would lead to the increased incidence of colon cancer in that family. So to answer your question, I think it would be important to seek counsel with a genetics counselor who could really go through the family history and decide if screening would be appropriate for the family members, and also to evaluate for a genetic syndrome.
That's wonderful advice. And I've actually read that next to a pap smear, a colonoscopy is the most effective form of cancer screening, but yet fewer than half of the people who should get a colonoscopy actually get one. Why is that?
Very good point, Nancy, and thanks for bringing that up. It's so important to get this message out to people that screening is just that. It's meant to prevent prevent cancers. In this situation, colonoscopy would be considered the best test to prevent colon cancer. Again, we recommend it at least starting at age 50, and possibly for patients who have family members with colon cancer, that age would actually be younger, and the guidelines would need to be followed in that situation. Unfortunately, as you stated, only about 50% of people do get screened, and I think the reasons are multifactorial. First and foremost, it's a topic that might be embarrassing. No one really wants to talk about an organ that deals with bowel movements. So I think getting past that point is important for people so that we can have an open conversation about this. I think also there might be some myths out there that patients don't need to be screened if they don't have family history, but those are the most important patients to be screened. Even patients without family history of colon cancer need screening. And then finally, it is considered an invasive procedure, so there may be some trepidation or fear regarding undergoing an invasive procedure, but I can assure you that thousands, hundreds of thousands of colonoscopies are performed in our country safely every year. And most of the time we're finding polyps, we're removing those polyps and thereby preventing colon cancer. So the benefits of having this procedure, although possibly embarrassing to discuss, uncomfortable to go through a preparation to cleanse the bowel, it's a very important test to have done.
And we've all seen the commercials for the at-home colon cancer screening. What is your take on these do-it-yourself kits, and who or who may not be a good candidate for them?
So these have gained more and more popular interest over the course of the last 5 years. Some of the older tests are actually, there are 3 basic tests. Some of the older tests are actually fecal occult-based tests. So blood tests, they're actually picking up blood in a stool sample. And those are the original tests that we use to detect blood in the stool. Throughout the years, we have developed better testing. Specifically, a test that's commonly used for screening is fecal immunochemical testing. And that's a little bit more specific to the colon and will certainly help pick up blood in the colon. And then you have the DNA testings, which are picking up mutations in large polyps or actually cancerous lesions. Some of the advantages of those are that they're non-invasive, they don't require prep, they can be done in the comfort of your own home, and they're certainly worthwhile tests to consider. The disadvantages of these tests are that if you're already picking up blood in the stool, that implies that there might be a large polyp or already a colon cancer that could be bleeding. So then we're not preventing colon cancer, we're in the realm of treating the colon cancer or the large colon polyp at that point. So I would say these tests have a role, and certainly they're a good starting point for patients, especially if there, again, is that trepidation or fear of going through a colonoscopy. So I'm not opposed to those tests, but what I want people to really understand is they're not preventive tests. The only truly preventive form of screening is colonoscopy. Because again, we're visualizing the colon, we're seeing small polyps, we're removing those polyps before they can become colon cancers.
Great advice. And we talked a little bit earlier about who should receive a colonoscopy. Tell us a little bit about what are some of the specific risk factors for colon cancer and who's most at risk.
So risk factors regarding colon cancer are many. Primarily, we mentioned that if you have a family history of colon cancer, that increases your risk for colon cancer, especially if you have a first-degree family member. Also, a risk if a family has colon polyps throughout the family, that can increase your risk. More specifically, those patients who have the polyposis syndromes or the hereditary form of colon cancer that's inherited in the family are at increased risk. And we want to identify them very early so that we can start their screening much earlier than the stated age of 50. Furthermore, patients who have inflammatory bowel disease, specifically Crohn's and colitis, they're at a greater risk for colon cancer. So we screen them earlier and more frequently, generally. Other patients in general that are at risk, obesity is a risk factor for the development of colon cancer, and diabetes. Diets high in red meat and low in fiber are also risk factors for the development of colon cancer.
And we always hear about the importance of a healthy diet. Is there anything in particular people should be eating to try to avoid colon cancer?
Yeah, I wish there were one magic food that would be the preventive food, but in general, I always tell patients, eat a balanced, healthy diet. It's all those things your mom always wanted you to eat at dinner, your broccoli, your spinach, a diet high in vegetables, fruits, and fibers, and low in red meat. And if you're going to want a high protein diet, then it should be lean meats and possibly legumes, beans.
Perfect. And you mentioned a high fiber diet, and fiber seems to be inside of everything right now, from cookies to granolas to even little gummy pills. Is there a difference between fiber from fruits and vegetables and fiber found in the gummy supplements, and which would you recommend?
Yeah, there's somewhat of a difference, but whether or not it actually makes a difference in decreasing colon cancer is controversial. So in general, anything that's naturally given to us from the earth is probably healthier for you as a form of fiber. Specifically, whole grain cereals are very important in the prevention of colon cancer. Again, we would recommend a diet that's balanced and healthy and low in red meat consumption, higher in lean protein, and definitely higher in general in fruits and vegetables.
And you mentioned earlier about inflammatory bowel disease being a risk factor. It seems like more and more people these days are being diagnosed with inflammatory bowel disease or possibly self-diagnosing. How significant is inflammatory bowel disease when it comes to colon cancer?
So I think it's important to differentiate two entities that you and I had previously discussed in writing. Irritable bowel syndrome, or IBS, is very different than inflammatory bowel disease. So when you mention self-diagnosis, it may be that those patients actually have irritable bowel syndrome and not inflammatory bowel disease. A syndrome is what doctors lump, a constellation of symptoms and signs that doctors lump together and don't really have a clear etiology or cause for. And these symptoms of irritable bowel syndrome start with abdominal pain, sometimes bloating, sometimes change in bowel habits, constipation, diarrhea, or the alternation of those two signs. Now those aren't unusual or much different than colon cancer or symptoms associated with inflammatory bowel disease, but inflammatory bowel disease is a very specific, separate disease entity compared to irritable bowel syndrome. Inflammatory bowel disease encompasses Crohn's colitis and ulcerative colitis. These are truly inflammatory conditions of the intestine. Crohn's can be anywhere in the GI tract from mouth to bottom, and ulcerative colitis usually affects only the colon. So those symptoms can also look like irritable bowel syndrome, so bloating, abdominal pain. These change in bowel habits, but those patients generally have other more alarming features such as bleeding, which may look like dark black stool or bright red blood. They may be anemic, having a low blood count. They might also start to lose weight because they tend to have maybe malabsorption. And so there are a lot of other signs in inflammatory bowel disease that raise red flags for us. But that group of patients is definitely at higher risk for developing colon cancer, and our screening guidelines would be different than what we would consider for the average risk patient.
And you just mentioned some of the signs and symptoms of colon cancer. What are some of the other signs that people should be on the lookout for?
So I mentioned bleeding, including bright red blood from the bottom. Black stool can also be a sign. Weight loss, change in bowel habits, whether it be constipation, diarrhea, or just alternating stools that might not seem so severe to someone, or it might be a gradual change for them and they may not recognize that. Some people can have fatigue, mostly because their red blood cell count will drop or their hemoglobin, hematocrit will drop, and they will get anemic. So unfortunately, once a patient develops those types of signs and symptoms, it generally means that they have an advanced colon cancer, not just back to need for screening in order to prevent this deadly disease.
And what should somebody do if they are experiencing any of these signs and symptoms?
Definitely call your doctor. Go see your physician. An astute physician, whether it be a family practice physician or an internal medicine doctor, can start the workup for that, and then will likely refer that patient to a gastroenterologist for further evaluation, possibly an endoscopy or colonoscopy.
That's great advice, and we do want to remind you that gastroenterologist Dr. Cynthia Harris is here to answer all of your colon cancer questions live via Facebook. Unfortunately, she cannot make a diagnosis or treat somebody through Facebook. So if you're looking for a personal diagnosis, please call 1-888-MOFFIT or log on to moffitt.org to make an appointment. We do have a question from our Facebook friend Anna. She is wondering, Dr. Harris, if you have any thoughts on the recent study from the American Cancer Society that shows an uptick in rates amongst younger age groups, and any reasons why this may be happening, especially amongst adults in their 20s and 30s.
Okay. Thank you, Anna, for your question. In all honesty, I've not read the study, so that's my qualifier. As I understand it, though, the researchers aren't quite sure why we would see an increase in this diagnosis in that age group. I guess in theory we could talk about obesity in our country, and that is a risk factor for the development of colon cancer. But other than that, I'm not sure we know why that is. It also might be that younger people are undergoing testing earlier than before. Now that we recognize that it's not only age specific in that age group over age 50, we're more apt to go ahead and perform colonoscopy or evaluation in that age group rather than just to write that off as their symptoms as being insignificant. So for instance, if a 20-year-old comes to me with complaints of blood in the stool, because we have seen those cases here at Moffitt, I would go ahead and recommend colonoscopy for that individual. Although we're dealing with the odds would say that they don't have colon cancer, I think it's very important to go ahead and evaluate them. So in answer to your question, I'm not sure we know why. Hopefully further research will help us figure those questions out.
And we do want to thank you, Anna, for submitting that question via Facebook. And we want to encourage everyone to please submit their colon cancer questions in the comments below. We do want to mention that Moffitt is hosting a free colon cancer awareness event right here at the hospital on Saturday, March 11th from 8 a.m. until 12:30 p.m. The event will have educational sessions in both English and Spanish, and plus the giant inflatable colon will be here at Moffitt Cancer Center. Now, do you remember that movie Fantastic Voyage where people actually shrunk down and traveled throughout the human body?
Yes.
Well, Moffitt Cancer Center is giving you a chance to do just that. The giant inflatable colon is a 20-foot colon that actually allows people to walk through it and see the difference between healthy tissue, Crohn's disease, polyps, and even cancer. Now, Dr. Harris, the giant inflatable colon has been here at Moffitt in the past, and you've witnessed it.
Yes.
Tell me a little bit more about it.
Sure. So I'd also like to talk about the event. Absolutely. In addition to the giant inflatable colon, we're so excited to have this event. We haven't had this event in about 4 years. So it's a labor of love for all the staff that have been involved in the planning process. But we're offering educational sessions in both English and Spanish in the morning. The event starts at 8 o'clock, or registration does at 8 o'clock, and it will go until about 12:30. The sessions are split into 2 sessions so that patients or people that are attending the event will have time to enjoy the giant inflatable colon, which is the centerpiece of the event. So we're very excited to have that. I think it will allow for great information, not only during the sessions, the didactic portion of the event, but also you will have the opportunity to ask many healthcare providers, including physicians, nurses, dietitians, and nurse practitioners, the questions that you might not feel comfortable asking otherwise. Having that as our centerpiece really opens up the dialogue for further discussion on colon cancer. So it's an excellent event. I hope everyone will come out and join us for that.
And what is some of the reaction that you've seen from people who walk through this giant inflatable colon for the first time?
Yeah, it's really great. First of all, it's so large, it kind of takes you by surprise when you enter. But there's a lot of curiosity around the giant inflatable colon, and as patients walk through it, there are examples of polyps, both early polyps and advanced polyps and colon cancer. There's also things to show what Crohn's and ulcerative colitis looks like. So having that visual really helps the interaction between provider and patient, and it certainly, I think, makes people think more about this disease, and it facilitates that kind of question-answer session.
And we talked a little bit earlier about how some people may be embarrassed to talk about some of their signs and symptoms of gastrointestinal health. How does that giant inflatable colon kind of ease people into having that conversation, not just with their family, but also with their doctor?
Yeah. I think it definitely opens up the conversation and makes people more comfortable. Many times in the past, when I was involved in the event, I would walk a patient through the colon. And so it really allows patients to be at ease. It's an environment that's very welcoming and friendly. And again, the visual effects of it help patients think of questions that they might not have already thought of in the past.
Wonderful. And we hope everybody will join us on March 11th for the educational sessions in both English and Spanish, and also take a tour through the giant inflatable colon. That event is being held right here at Moffitt Cancer Center on March 11th from 8 a.m. until 12:30 p.m. Dr. Harris is here on Facebook Live answering your colon cancer questions. Now, as we mentioned earlier, colon cancer is the 3rd most common form of cancer. Now, for somebody diagnosed with the disease, what are the treatment options?
So there are many treatment options for colon cancer, and I think we've pushed the envelope forward in a decade or two regarding treatment, and also in improving overall survival and cure. So the primary treatment option would be surgery. We always try to get patients to surgery to take out the colon cancer as well as all the lymph nodes around that malignancy. And then there are forms of chemotherapy and or radiation. And depending on location in the colon, sometimes we offer chemo and radiation up front versus after surgery. So chemoradiation first, followed by surgical resection, and then in other cases we offer surgery up front, followed by chemo. And then throughout the course of that patient's life, we'll be very careful to follow them closely and put them into what we call a surveillance program, which would include repeated colonoscopies, CAT scans, PET scans, and eventually we hope for that 5-year mark of being disease-free without malignancy. We would enroll them into our excellently staffed and a well-managed survivorship clinic here at Moffitt for the rest of their lives.
And is there anything new in colon cancer treatments?
New as probably there are more developments in the chemotherapeutic arena regarding colon cancer. I think the surgical technique has certainly improved from the time I was even in medical school, and overall One of the things that I think has improved at least our outcomes here at Moffitt is that multidisciplinary approach to all cancers, including colon cancer. So here at Moffitt, you would have a medical oncologist who would likely be able to answer that question better than I would as a gastroenterologist. You have a radiation oncologist, a surgeon, and a gastroenterologist, all as your team members. So working together, we would come up with the best course of treatment for that individual.
Wonderful. And we do have Dr. Cynthia Harris answering all of your colon questions live here on Facebook. This is Moffitt's Ask the Expert series. Please place all of your colon cancer questions in the comments below. We do have a Facebook question from Carmen. Carmen is asking, what are the pros and cons of participating in clinical trials?
The pros and cons of participating in clinical trials. Well, hopefully, our primary goal for treatment, right, is to get patients to have a cure of their disease. The majority of patients will get great benefit from non-clinical trials, so what we would consider standard of care. Those patients that go on to be enrolled in clinical trials, specifically regarding colon cancer, are generally those patients who have recurrence of their disease or have considered failed therapy. I think the pros for the individual patient are that it offers more options. And I think it can extend life, it can offer curative intent. So there are many more pros than cons to being enrolled in a clinical trial. Quite frankly, I can't think of many cons to being enrolled in a clinical trial because patients want the best shot at cure, and if they've failed standard therapy, then that is one of the only options at that point, would be a clinical trial. And that's not to say, oh, this is your last effort, you have to do it. I think it's an individual decision, and it certainly allows for just further treatment. It also contributes to science in a way that, and helps us with better discoveries for those patients to come after you. So we would highly recommend, if that's right for you, to at least be counseled on a clinical trial. And every clinical trial has pros and cons within the trial, so you have to decide if that's appropriate for you.
And Moffitt's CAR-T clinical trial got a lot of attention yesterday, made national news, and we have our Facebook friend Ken is asking if CAR-T would be a possible therapy for colon cancer in the future.
Oh, Ken, I'm sorry. Thank you for your question. I don't know if I'm the right person to answer that question. I'm unfamiliar with the trial, especially if it was just published yesterday.
That's understandable.
Sorry about that.
Is there any type of immunotherapy that's available for colon cancer treatments?
Also, good question. I apologize for not knowing the answers to those questions. A medical oncologist would be the person that would give the chemotherapy, and certainly I would defer to them. I wouldn't want to spread any bad information to patients.
Absolutely. We also have a question coming from Tom. He is asking, what, if any, support services does Moffitt provide to colon cancer patients and their families?
So here at Moffitt, we try to provide all services that we think patients and their families would need. I know that this is part of a support service and that we're providing education. Certainly your team of doctors, I think, provides a good source of answers to questions and also support. In addition, we have many groups here at Moffitt that get together and support each other, whether they just be patients or family members of patients. So there are several things that, several services here that can be looked into.
Wonderful. And Tom, his second part to that question is, how could treatment impact his fairly active lifestyle?
So I guess it would depend on the type of treatment, Tom. Thank you for being active. That's one way, obviously, to stay healthy. And certainly here in Florida, there's a very active population, sometimes greater so than where I'm from, which is the South. So in general, If you've had surgery for colon cancer, there's a recovery period for that. I would say, depending on what type of surgery is done, sometimes you have open surgery, sometimes there's laparoscopic surgery, sometimes there's robotic surgery. The recovery for laparoscopic and robotic surgery is going to be somewhat quicker. The recovery for open surgery longer. But in general, you should expect to be out of commission for most physical activity for about 6 weeks maybe. And then after that, barring any complications or problems with the surgery, you should be able to go back to a healthy lifestyle. And if we're going to talk about chemotherapy and how that affects patients, really what I've seen is that no one regimen affects every person the same way. So it really is individual. And I think one of the myths of receiving chemotherapy that people think of is that you'll lose your hair. And that's not always the case. We have plenty of forms of chemotherapy that are milder than other forms. So it really is individually based.
And we have one last question from our Facebook fan, Harley. She was diagnosed with colon cancer at the age of 36, and she would like to know if cancer is spread to multiple lymph nodes after a colectomy for colon cancer. How can doctors tell if there are more lymph nodes that may be cancerous?
Sure. Good question, Harley, and thank you for asking that question. And I'm sorry for your illness. That's certainly difficult to go through at any age, but that's certainly when you're young. Now, when we talk about treatment and lymph node involvement, we generally use a combination of studies to see if there are any lymph nodes involved at the time of the diagnosis of the primary tumor. So most likely, the degree of lymph node involvement would be found at the time of surgery. So as they remove the colon mass, they would also take all the lymph nodes in that area, and then we test them. We look at all of them. A pathologist looks at all of them, and the pathologist would tell us how many lymph nodes did we take and how many of those were involved in surgery. That helps with a stage, thereby helps with treatment, thereby tells us what the overall prognosis is. Once that is performed, surgery is performed and all the lymph nodes are removed, possibly chemotherapy was given. It's hard to say in any particular case without being privy to the details. We would offer chemotherapy for curative intent, and then as time went on, we would follow that individual looking for lymph node development by scanning them. Probably CAT scan and PET scan, and that would be one of the ways that we would find lymph nodes that might pop up later as malignant.
Wonderful. This is all great information, and it seems like prevention is key. Eat right, exercise, and get those colonoscopies. Thank you so much for joining us today, Dr. Harris, to talk about colon cancer and answer our Facebook fan questions. We want to remind everyone again to please attend Moffitt's free colon cancer awareness event taking place on Saturday, March 11th from 8 a.m. until 12:30 p.m. We'll have educational sessions in both English and Spanish. Plus, the giant inflatable colon will be here, and you don't want to miss that. Thank you again for joining us for Moffitt's Ask the Experts. Remember to log on to moffitt.org to learn more about all types of cancer and to make an appointment.